Welcome to adapting class. Let's do some quick questions about pharmacology that you're supposed to know. I pick up about 41. We're just going to talk about them quickly. Concept. And I just want to show you the key aspects that you need to focus on these medications. The first question is our concept that you should know. So it's just straightforward. If you know it, you pick the answer and you just go. Which of the following is a priority before administering the medication? And this is caring for a client 24 hours after exploratory laparotomy, which is surgery. An order of 0.2 hydromorphine, right? IV Q4 hours for pain was prescribed. Which of the following is a priority? Keywords: priority. What is the problem? Patient had surgery. What is the issue? We've been giving this hydromorphine. What do you think is it? This is the opiate. What is the number one problem you should worry about in opioid? Respiratory issue. He has constipation, which is not a problem. They're going to itch is not a problem. Because his urinary retention is not a problem. This is what is going to kill the patient. This is what we call being sharp. You are being sharp by looking at something that will kill the patient. This medication has a lot of side effects. But which of this is more dangerous? Respiratory, depression. Okay, that's the way you do pharmacology. The most important aspect of this side effect is what you focus on. Number one is that. Number two, same thing, same strategy. Which of the following need immediate intervention? Select or apply. And this is caring for a what? 35-year-old male with what? Clozapine. Like I told you, I'll focus on the key aspect. If you need details, check Adapt NCLEX. But this is the way you approach pharmacology question. Bring your content. You recognize this. It's a second generation antipsychotic. What is his biggest problem? Agranulocytosis and QT prolongation. That's all. I'm giving you the key fact. This is his biggest problem. This is his B-sharp moment. When the board asks you, they worry about the B-sharp moment of that medication. Weight gain is common. Don't worry about it. Gynecomastia is common. Don't worry about it. Runny nose, yeah. Infection, I'm worried about it. WBC of 3,600, it has to be less than 3,500. So this is okay. Magnesium, 1.2, QT prolongation. Therefore, your answers, number 3 and number 5. This is what I'm trying to let you know. If you common side effect, ignore it. Go for the B-sharp moment. Tell yourself, I'm going to the kill. You're going for the jugular. The jugular is infection and QT prolongation. Number 2 is done. Number 3. Which of the following assessment need priority intervention after the medication? And this is caring for a client admitted for conduct disorder. Fine. Client pushed the nurse during intake assessment and was chemically restrained with 5 milligrams of what? Allopuridol. This is the medication. Do you recognize it? Break the question down. Patient was admitted, was abusive. We give the patient antipsychotic, first generation. What do you think you should do after that? What is the biggest side effect for this? NMS. EPS is not the biggest side. EPS, extrapyramidal side effect, as acute dystonia, Parkinsonism, tardive dyskinesia, and then the way to remember is ADAPT. Okay, acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. They are not that serious compared to NMS. Therefore, in my answer choice, painful muscle contraction, this is dystonia. I'm not worried about it. Inner feeling of restlessness, don't let the word trap you. That is akathisia. Muscle rigidity, yes, I'm worried. NMS, its temperature is fine. Usually when you have NMS, temperature will be 103. So don't pick this answer. Okay, this one is normal, but this is the most dangerous. When you see this, it's fine. All of them are in what? Digoxin. You have to be familiar. All the medication I'm picking, these things you have to be familiar. Digoxin. Which of the following is concerning? Then you tell yourself, what do I know about digoxin that should be concerning? All client drug level is 2.5. It's too high. Digoxin is 0.5 to 2. Therefore, this is concerning. 6-month-old client take the medication with food. No, nothing. You don't take it with anything. 55-year-old client is on diltiazem for hypertension. Digoxin, avoid calcium channel blockers. 10-year-old client with the EKG shows a heart rate of what? 72. But when you check the apical pulse in 1 minute, it's 69. 60, 70, 90. This is adult, child, and neonate. If it's less than any of them, don't give it to them. Child, less than 70, 69, we have a problem. All clients, BMP, potassium is normal, magnesium is normal, calcium is normal. We're good. 6 months old is having diarrhea. 10 years old is having anorexia. 55 years old is having what? Nausea. Digoxin, GI symptoms, number 1. Any GI symptoms, it shows toxicity. This guy, this guy, this guy, all toxic. So which one is concerning? That one. 1, 2, 3, 4, and 6 are all concerning features. So that's your question. Number 6. What do we have? Which of the following the nurse should include in the discharge teaching? Which of this? Recognize the medication a nurse is caring for a 50-year-old admitted with what? Acute diverticulitis. Client was discharged home with what? Metronidazole. That's your medication that you have to know. Which of the following teaching is needed? Which of the following the nurse should include in teaching? Do you recognize this? It's a medication you should know. And what you should know about it, it has metallic taste. So that's good, nurse. Your urine will turn dark. That's what it's going to do to you. Don't use too much aftershave. This is wrong. When you're on this, you should avoid alcohol as much as possible. Otherwise, you're going to get sick. And when you finish the medication, you have to wait at least 3 days. Too much, don't use too much. I want you to avoid aftershave completely. Aftershave has alcohol in it. So this is a wrong teaching. Wear long sleeves and hat when you're going out. It's a sulfur drug. So photosensitivity is good. Don't go out the sun when you see small purple rash on the chest. I'm trying to track you multiple times to think critically. If you develop small purple rash on a medication that is a sulfur drug, this is early sign of Stevens-Johnson syndrome. This is the wrong teaching. So which of the following the nurse should include? This is a bad teaching, so you should not include that. When you see a small purple rash on your chest, you go to the emergency room. Don't say don't go to the sun. So 1, 2, and 4 are your right answer. Number 6, down. Number 7. Which of the following will cause the nurse to question the prescription. It's going to question the prescription. The 55-year-old male is now post cardiac stent placement. Client was prescribed what? This is your medication, Clopidogrel, for outpatient management. Which of those will cause you to question it? Ask yourself, content, Clopidogrel, what is this? Anti-platelet. I don't look at the answer choices. I figure out what I'm supposed to see in the answer choice. That is what I want you guys to do. If you do that, the thing will become easy. If somebody tells you otherwise, don't believe them. Don't look at the answer choice. If I know what I'm looking for, then the answer choice is going to be easy because I know my answer already. So that is the strategy when you answer questions. Don't look at the answer choice. First, try to figure out what the question is asking you, then you proceed from there. So if you do that, you'll be fine. So what is this question? Again, what do you think? What do you think based on what the patient, the description is being given? What do you think? It's just straightforward. Antiplatelet, you're going to bleed. Antiplatelet is going to affect your platelet. If I see anything related to platelet, I'm picking it, right? Brown stool, you're having normal stool. It's not black tarry. You're taking cholesterol medication, it's unrelated. He's using electric clippers. He does not want to bleed. Therefore, platelet. This is what I want you to guide to master. Test-taking strategy. It's a platelet problem. I'm looking for answer related to platelet and bleeding. Number 8. Select or apply. 35-year-old female was diagnosed with what? Active TB. Client was discharged home with what? Isoniazid, Rifampin, and Tabitol, and streptomycin. These are what you discharge them with. We took the following statement regarding what? Rifampin. I want you to focus on Rifampin. Need further teaching. It's one of the TB medication. Okay? I will continue taking my birth control. Bring your content. This will make your birth control not effective. I want you to wear a barrier method. So need further teaching. My underwear may stain orange and red. Every secretion is going to stain like that. So good. I will swap my lens for a regular lens, glasses. Yes, your lens will stain, so change it to regular glasses. I expect tea-colored urine. This is not the same as orange red. Tea-colored urine is liver problem. Your LFT is high. Your bilirubin is high. This telling you that the liver is in trouble. All TB medication affect the liver. Therefore, if you see signs of liver injury, yes, you got to intervene. We don't expect this. We don't want it. I need further teaching. I will complete the full course medication time course. Excellent. It's an antibiotic. Take care of it. So 1 and 4 are not good, are not good at all. Okay, so those are your right answer right there. Number 9. 35-year-old client with DVT was prescribed, do you recognize it? Enoxaparin. That's the next medication you should know. Which of the following statement from the client need further teaching? I'm just using concept to tell you what you should focus on. Is enoxaparin, is heparin, okay? Sub-Q heparin, we inject it. Where? We inject it laterally, okay? 2 centimeters from the umbilicus. Look at the answer choice. Intramuscular, no. Subcutaneously, into the fat, not in the muscle. If you put it in the muscle, they bleed. Which of the following from the client need further teaching? this one. I will take acetaminophen for pain. Yes, avoid NSAID. I will keep the needle at 45 degrees for BMI of what? 20. If your BMI is low, you inject 45. If your BMI is high, you inject 90. No further teaching. I will need to avoid green leafy vegetables. Negative. You don't need to change your diet. You don't need to eat any special diet when you're on Enoxaparin. So further teaching. I will call for black tarry stool. You bleeding. Excellent. Does not need further teaching. Straightforward question is all content. So 1 and 4 need further teaching. Next question. Which of the following antibiotic was prescribed? A nurse is caring for a client with what? MRSA infection. Antibiotic was prescribed. The client had what? Flushing of the face, the neck, chest with intense erythema and itchiness during infusion. A bunch of words. I know you know it. Break it down. I give you a clue. MRSA infection, number 1. And then when you start infusing, we have the face, neck, chest, intense erythema, itchiness, all over. This is not an anaphylactic reaction. There is no change in your blood pressure. There is no wheeziness. Don't get trapped. The patient neck, face, chest is all red. This is what we call red man syndrome. Who causes red man syndrome? Penicillin does not cause red man syndrome. Linezolid is a form of vancomycin, but it's oral form. It does not cause red man syndrome. This is vancomycin. Gentamicin, hearing problem, neuro problem, and what? Kidney problem. So 3 is your answer. Like I told you, it's all content. That's red man syndrome. Number 11. A nurse is caring for a client on Omeprazole. I want you to know Omeprazole. The medication I'm picking, not exactly the medication, but that class of medication for GERD. Which of the following shows a therapeutic response? GERD, you have acid issue. I give you something, Omeprazole, it blocks acid secretion. Therefore, in your stomach, acid should be very low. There's no acid. If your acid is low, your pH is not going to be low. If you have pain when you're taking the medication, after taking the medication, it means it's not working. If you are bloating, it's your reflux. Test taking strategy, pH is 7. I've already eliminated this, and this is my answer. pH of 7.8 is alkaline. It's because I have no acid in my stomach. Therefore, the right answer is number 4. Number 12. Which of the following medication the nurse should question? I have to have a problem with it. A nurse is caring for a client scheduled for what? Cardiac angiogram. Cardiac angiogram. Cardiac angiogram. You say, what angiogram? Cardiac angio. I'm going to take a picture. What am I going to use? Contrast. Which of these problems hate contrast? Acetaminophen does not hate contrast. Lisinopril does not hate contrast. Carbamazepine does not hate contrast. These hate contrast. If you give them contrast, they develop lactic acidosis. You have to stop metformin at least 48 hours before, or if you have 24 hours, it's fine, but 48 hours before and 48 hours after the procedure. So no metformin and its complication. I'm just giving you things they will ask you. Which of the following additional lab work, the lab value the nurse should anticipate from the physician? A nurse is caring for a client on what? Lisinopril, atorvastatin, and metformin. Client report sudden onset of what? Dark urine, okay, muscle cramps. BMP shows potassium of 6. This can be a full case for you. Which of those do you need to order? Do you need? Look at it. The patient is on lisinopril, atorvastatin, and metformin. All of a sudden, urine is dark, muscle cramps. His potassium is 6. So potassium is 6. We have muscle cramp, buzzwords, right? And dark urine. What do you think? This combination is what? Lisinopril does not do that. Metformin, unless I give you contrast before it does that. What is doing the problem? Atorvastatin. Do you know what he's doing? Muscle cramp. You have muscle injury. It has turned into rhabdomyolysis. This patient is in rhabdomyolysis because of what? Atorvastatin. Therefore, what do? You check for muscle damage. Sodium is not going to tell you muscle damage. Hemoglobin is not going to tell you damage. His cholesterol is not going to tell you muscle damage. His creatinine kinase. But you have to be able to figure out and pick up the buzzwords, put it together, and make your case. And that's what I did. 3 things here. Number 3, answer choice. 14. Which client situation need immediate intervention? A nurse is taking care of, 4 patients in the med-surg unit. All of them on amiodarone. How do you do prioritization? Divide it. Look at the problem and the next one. I see all amiodarone. I write my acronym, P-clone. If you're on amiodarone, you'll be cloned forever. If you're on amiodarone, you are cloned forever. That means the P is a pulmonary problem. Okay? The C is a cardiac issue. L is the liver problem. N is neurological problem. E is endocrine. And D is dermatitis. What is the most dangerous thing about amiodarone? It's P. P, pulmonary fibrosis. If you take amiodarone and you have pulmonary fibrosis, you're dead. That's why I call it P-clone. Amiodarone, AST is that. So LFT will go up. Don't worry about it. Amiodarone, TSH is high. Don't worry about it. It's supposed to put high here. Don't worry about it. Drowsiness, neurological problem. Don't worry about it. The only thing you worry about is cough. The cough, you do PFT. The cough means they have fibrosis. It's dangerous. Dangerous. You are P, clone. You have pulmonary fibrosis, you'll be cloned. So, number 4 is your answer choice. Number 15. Which of the following situation need immediate intervention for client? On the med-surg unit. Client, this guy has hypertension, prescribe propranolol. Well, it will take care of your blood pressure. I have visceral bleeding, give propranolol. It will decrease secretion. I have asthma, you give me propranolol. I don't like it because propranolol is a non-selective beta blocker. It's going to push me into bronchoconstriction. You don't like me. That's why you're giving me propranolol. Social anxiety disorder, we can give you propranolol to calm you down, like stage fright. You want to go speak and you can't, we give them beta blocker, calm them down, able to. Asthma patient hate non-selective beta blocker. You want a selective beta blocker. Bisoprostolol, atenolol, metoprolol. That's what we call BAM. This one, you kill an asthmatic patient. They don't like it. Number 16. The next is reviewing phone call from clients with CHF. They all have CHF. Which client situation need immediate callback? They are on what? Furosemide, right? Dizziness from sitting to standing position. I want you to rise slowly. It's okay. Furosemide, complaint of sunburn during outdoor, is a sulfur drug. You're going to have photosensitivity. It's okay. Just wear a long sleeves. Furosemide, muscle twitch. I don't like you. Your potassium is low. Furosemide, weight gain, 2 pounds over 2 days. You have to know these numbers. Greater than 3 pounds in 2 days or 5 pounds in 7 days, that's CHF. This guy is not in CHF. Who do you see? Number 3. Number 3 is your boy. 4 is not in CHF. He has not met the criteria. You need 3 pounds in 2 days, 5 pounds in 7 days. Number 17. 4 clients in the postpartum ward with hemorrhage. They are all hemorrhaging. Which client situation will cause the nurse to question the prescription of what? Methylergonovine. You have to know this medication. What is used for? Is used for postpartum hemorrhage. How does it work? Vasoconstriction. Anything problem that you have that the vasoconstriction is going to make it worse, you should not use it. Migraine help by causing vasoconstriction. So this is it help the migraine. Coronary disease, no, it's not going to like it. Postpartum hemorrhage, yes, it's going to prevent the bleeding. We like it. Hypertension, I'm not going to like it. So this patient, 2 and 4, we are not happy with them. We can't prescribe it. The nurse should question the medication on this patient. So those are the ones you have to question. Next question. Which client need immediate intervention? Immediate phone call. Which one of them? Which one of them need immediate phone call? A nurse is in a mental health clinic returning phone call from client, mental health clinic. All clients, they are on what? Lithium for bipolar. Therefore, you write down all these 2 questions, answer a long sentence, just write lithium. I have to intervene. Which of this I have to intervene in lithium? When you're on lithium, ACE inhibitor, stay away from it. It decreases your sodium. Hydrochlorothiazide or diuretic, stay away from it. It makes you dehydrated. NSAID, stay away from it. It makes your kidney damage. GI symptoms, call me. You having toxicity. What do we have? Client with the lithium 1.2 level is good. I don't need to worry. Hypertension and enalapril, ACE inhibitor. I'm worried. I have osteoarthritis, Motrin. I'm worried. I have hypertension, giving diuretic. I'm worried. I have nausea, diarrhea for 2 days, GI symptoms. I'm worried. Using salt substitute is supposed to say salt substitute what? Your sodium is going down and your potassium is going up. Salt substitute is all potassium. Therefore, I'm worried about that one too. The only person who is safe is number 1. But this was designed to give you all the B-sharp moment for lithium. And that's what they will ask you in your exams. Things you should avoid while you're on lithium. That's all. So 2 to 6 are all bad problems. Number 19, select or apply. Select all that apply. Don't fear it. I mean, I know there's so many methods. I think there's no method. The only method is break down the question, know what the examiner is telling you, and come up with something you're looking for and pick the answer you're comfortable with and move on. There's no method to select or apply. You just get the content down, break the question, and look at what I'm going to do. Which of the following teaching need intervention? All I need to do is intervene by the charge nurse. What is the problem? Nurse is providing teaching for a client prescribed what? Levothyroxine. You have to know what it is. What kind of medication is it? If I remove your thyroid and I give you something, I'm trying to replace your thyroid hormone. You have to know these things about this medication. You take it in the morning. You take it on empty stomach. These are all the questions I've said is like giving you a lecture. Key aspect of the medication. We don't want you to eat with it. So you take it without food. If you want to eat before you take it, you have to wait 2 hours. Take medication together with calcium. Calcium affected. Antacid, they hate it. Take medication even if no improvement, yes. So which of this the charge nurse should intervene, taking in 1 hour before and taking antacid. 1, 2, and 5 are normal. And you have to know when they give it to you, levothyroxine, a lot of people have hypothyroid, so you have to know so that provide better teaching for them. So the regular nurse is providing bad teaching. 3 and 4, the charge nurse should intervene. That is the approach. It's the approach to the question. Which of the following statements need further teaching? The same thing, teaching. A nurse is providing teaching to a 55-year-old client prescribed what? Do you recognize it? Residronate. Residronate. He has last name what? Dronate. Dronates are what? Bisphosphonate, used for osteoporosis or hypercalcemia. There is the way you take this medication. It's like levothyroxine. You take it in the morning with a lot of water. You should avoid calcium together with it. And you have to remain upright for 30 minutes because it causes esophagitis. These are key facts of that medication. That's what I've given you. It's not going to be residronate. If you see anywhere, they put alendronate, they all have the last name. All the medication I'm giving you, take that medication. If they change the name and they give you the same last name, you don't have to memorize every bisphosphonate. Just know the key aspect of it so that when they change it to alendronate, you tell the patient the same thing. It's bisphosphonate. You don't have to memorize the 15 million medication out there in every class. Just know one and their last name. Dronate, this is what you do to them. The all causes esophagitis, so you remain upright after 30 minutes. Select or apply. And nurse is caring for a client receiving what? Gentamicin for severe abdominal infection. Which of the following the nurse should question? Okay, I need to question this. And look at what I'm going to do. I just write a key aspect. Gentamicin, what are the 3 things I'm worried about? Urine problem, kidney problem, and what? Neuro problem, weakness. If you take Tylenol for acetaminophen for pain, good. I don't want you to take NSAID. If you drink a lot of caffeine, you're going to get dehydrated. Your kidney is not going to be happy. Gentamicin will go up. Hearing problem, I'm going to check your hearing with vitals. That's good. I want you to drink a lot of water to make your kidney happy. Weakness because of the neuromuscular, it blocks it. So we got to check. It tells us there's toxicity. That's select or apply. There's no magic. I just give you 3 words I know about the medication. I look at each answer choice and see if it matches my plan, my concept, my content, and then I kick them out. So which one we should question? Number 2, the order is not right. 22, select or apply. That's why I give you a bunch of select or apply to make you comfortable. You see that it's not hard. Which of the following noted on medication reconciliation require follow-up? That means I saw something and that require follow-up. What is the problem? Why? A nurse is caring for a client with what? CHF. Is taking the fields, sildenafil, for erectile dysfunction. Break it down. If you're on fields, is a what? Is a nitrate, form of nitrate. You should avoid every nitrate in the world. Isosorbide, you see, that is all I said. I never go and pick anything strategy. I said you should avoid what? Nitrate in the world. Anything. Don't take any nitrate. Look at the answer. If there's a nitrate there, you should what? Require follow-up. Isosorbide is a nitrate. Nitroglycerin patch is a nitrate. Merononon is a nitrate. Hydralazine is a nitrate. Nasiritide is a nitrate. I just want to give you all the nitrate in case you don't know them. These are all nitrate. If you're taking the fields, avoid all of this. So that's your answer. 23. Which of the following statements need further teaching? A nurse is caring for a client with what? Berger's disease. Client was prescribed what? Varenicline to what? Prevent further complication from the disease. I want you to know this medication in case you see that's the medication I want you to focus on. This is to use for what? Tobacco cessation, stop smoking. The problem is when you stop smoking, you're going to gain weight. Smoking, tobacco, nicotine is a stimulant. If you stop smoking right now, you're going to gain weight. I will need to increase my calorie intake to prevent weight loss. No, if you eat a lot, you're going to balloon up. So this needed further teaching. I will need to stop smoking now before starting the medication. This is the problem. People think when you're taking varenicline, you have to stop smoking. No, that's why they go cold turkey and they can't make it. You can smoke whatever you want, but take the medication. The medication decrease the craving and the hives from it, so that when you eat it, when you smoke it, you don't get the vibe from it. So you stop smoking. So this is neat teaching. Suicide is common, so you got to check them for depression and other things. I expect nightmares. This is common. They have nightmare for this medication. The medication decreases my cravings and highs from tobacco. So which one need intervention is 1 and 2. That's the one that need intervention because that's what need further teaching. But 3, 4, and 5 are normal for the medication. So suicide is a major risk for the medication. I expect nightmare, and the medication decreases my craving. It's all right. 1 and 2 are not right. (24) Select or apply. A client was prescribed what? Sertraline for long-standing depression. She presented to the emergency room. Pay attention. This can be a bow tie question or a full question. Temperature 103 after taking linezolid for MRSA. Breaking down. Sertraline, what is that? All of a sudden, I have temperature 103 after taking linezolid. This is what? It's an SSRI. Whenever you see somebody taking SSRI and their temperature is up, think about it taking something that is also increasing serotonin. Linezolid increases your serotonin. Therefore, if you take SSRI and you take linezolid, or you take tramadol, or you take sumatriptan for migraine, you take St. John's wort, all of them, your serotonin will go up. You develop serotonin syndrome. Serotonin syndrome, don't memorize any symptoms. Everything is going to go up. Diaphoresis is up. Bradycardia is down. Agitation is up. If you're hot, you're going to love cold. So you will tolerate cold. So this is wrong. Your deep tendon reflex is up. Tendon reflex is up. Therefore, 1, 3, and 5 are your right answer. That's what you should expect. So that's that question. Number 25, select or apply. Which client situation need immediate intervention? And this is caring for the following client. Coumadin, they love warfarin and Coumadin. And this question is a bunch of trap answers. A bunch of trap answers, right? I have AFib, 5 milligram of Coumadin, your INR is 2. It's good. I don't need to intervene. DVT, I take Coumadin and I'm pregnant. Right? I'm pregnant. It's a teratogenic. We got to change you to probably Enoxaparin. DVT, 5 milligram of what? Coumadin, I'm taking vitamin K supplement. You don't need to take anything. You don't need to increase your vitamin K. You don't need to increase your green leafy vegetables. Stay away from it. AFib, 5 milligram of Coumadin. I'm using electric clippers. Thank you very much. Prosthetic valve, 5 milligram, what? Coumadin and what? INR is 1.9. This is bad. They're going to form thrombosis. You want their INR to be 2.5 and 3.5. This patient needs further intervention. You don't need to choose all of them. If you're not sure of them, let it go. Choose the one you're more confident about. So 2, 3, and 5 are your right answer. Number 26. 35-year-old client with what? Tonic-clonic seizure is on phenytoin. Which of the following assessment need immediate intervention? One word, phenytoin. Buzzwords. You have to know the drug and what it does. It's used for seizures. I told you that. Most medication, 10 to 20, is therapeutic value. So don't worry about it. Softening and overgrowth of the gum. Gingival hyperplasia is normal for these people. Don't worry about it. You just have to decrease the dose. Taking oral contraception to prevent pregnancy. I'm worried about you. Your oral contraception does not work. You need a barrier method. Otherwise, you're going to get a baby who is defected. So horizontal nystagmus is an expected one. Don't worry about it. Taking medication with protein shake. Phenytoin, hate protein. You should not eat too much protein. If you're on 2 feet, you got to hold it for like 2 hours before. Therefore, we got to intervene. It's all content. Don't memorize it. Content. And you'll be fine. Next question. And next is teaching new graduate about how to mix 25 units of insulin and 25 units of NPH. Which of the following the next should include? This is the way I do it. I always, it's a little bit, if you have whenever I see mixing of regular insulin and insulin, I just write RN and NR, and I put inject here and air. That's all. So you inject air into NPH, then the RN, you Then you withdraw the RN, and then you withdraw the MPH. That's the way I do it. So inject air into the regular insulin first? No. Draw the regular insulin last? No. Draw the MPH last? Yes. Therefore, this has to be wrong. That's the way I do it. I know you guys know it, so this is freebie question, right? Cheap one. This is another content. Which of the following the nurse will recommend for DKA? A nurse is teaching new graduate about different types of insulin and their usage. Straightforward question. Or he's asking you, which medication is used for DKA? One word, one word, one word. And what is that? Regular insulin. Which one is regular insulin? I just wrote it here. That's all. Regular insulin. So pick regular insulin. These are not regular insulin. This is intermediate, right? This is very fast acting. So regular insulin is what you use for DKA. Same thing. If you know this, you know this. You pick it and you move forward. Which of the following time is a priority? And let's give 10 units of Aspart to a client at what? 8 o'clock. This is the lag, right? Very short acting, act really fast. And when they say priority, when they give somebody, if you give somebody insulin, the priority action for you is to go and see them at the peak of the injection of that medication. These guys have a peak between 1 to 3 hours. I'll go there 2 hours later and go and check on them. So 8 o'clock, I'll go there 10 and get. So when they ask you, when do you assess them and check them, they're referring to the peak of the medication. So the peak is between 1 to 3 hours for this medication. Therefore, go at 10 o'clock and take care of the patient. Otherwise, they will be hypoglycemic. Same thing. Insulin questions is straightforward. Which of the following is a long-acting insulin? Long-acting. Very short-acting. Very short-acting. Intermediate. Therefore, I got to pick this guy. That's all. You guys getting it? Like I told you, these are the medications I want you to focus on. Select or apply. A client with what? Severe psoriasis was prescribed. I want you to focus on the methotrexate. Which of the following teaching the nurse should provide at discharge? Don't worry about it. Methotrexate. If you recognize it, you know this is. And if you can figure out, I give you to a patient who has psoriasis. If I give this patient to a patient who has psoriasis, it's an autoimmune problem. Therefore, this will suppress their immune system. That's all. It's suppressing your immune system. If I'm suppressing your immune system, stay away from the crowds. Nasal flu vaccine yearly. It's a trap answer. It's a content you have to know. Avoid what? Live vaccine. A nasal flu one is a live vaccine. Oral polio is a live vaccine. MMR is a live vaccine. Nasal flu vaccine, no, don't give it to them. It's a live vaccine. Take frequent rest. Methotrexate, it suppresses your immune system. So your bone marrow will be suppressed. You cannot make sure your RBC will go down, your platelet will go down, your WBC will go down. This is all what the content is coming. Infection, anemia, and bleeding. So take frequent rest. Don't take aspirin because your platelets is low. And this is just content. Yeah, alcohol is never good. Okay, your test, alcohol. Okay, tobacco and caffeine. I call them cat. Every time you see them, they are never right answer. Avoid the cat. The cat is always completely kick them out. Caffeine, alcohol, tobacco is never good. So even if you don't know methotrexate affect the liver, you see alcohol, yeah, you got to pick it, man. So 1, 3, 4, and 5 are your right answer. $32. What should be the next response? A client with stable angina was seen in the outpatient clinic as a follow-up. Is taking, I want you to pay attention to this medication, nitroglycerin. You have to know everything about it. When I give it to you, I want you to know everything about that medication. That means you've done your pharmacology. Client complaint of headache. What should you say? Keyword. When you have headache, the medication is working. So don't stop it. If the medication is working, don't have the medication. The medication is not related to being orthostatic. So laying that up and will not change anything. So the best thing, tell them it's a common side effect. It will get better. But it's a common side effect of the problem. So don't stop it, don't have it, and it has nothing to do with the orthostatic condition. So lay down after taking it. The patient is not complaining about orthostatic. He said headache. It's because the blood is pooling in the brain. It's the dilation. The reason why you get headache is the vessel get dilated in your brain and you have more blood flow to your brain and you get headache. Laying down will not prevent it. Just tell them it's a common side effect of nitrate. The medication is doing its job. So 3 is the best response. I want you to know everything about nitrate. And I want you to know everything about gabapentin. Which of the following the next should include? Select or apply. And then she's teaching the client about what? Gabapentin. Okay, gabapentin for back pain, about the medication. What do you know about it? This medication is anti-seizure medication, okay? So anti-epileptic, but it can be used for so many things. You can use it for back pain. Because it's anti-seizure medication, it can affect your brain function. So drowsiness is very common. Okay, drowsiness is very common. So that's why you don't take the medication when if after taking it, you should not drive. If you drowsy, sometimes you get tired. So frequent rest, fatigue. Your brain function, this is the most common side effect, nystagmus. You can see blurred vision kind of feeling. Most people complain about weight gain and they have like leg edema. And it make your mouth dry. This is just to give you content of gabapentin. So all of this is right. If you never heard about it before, side effect, weight gain, fatigue, drowsiness, nystagmus, and then dry mouth. So sugar-free candy is good for you to keep your mouth wet. That is the content. It is the content. Then this one. Which of the following the nurse should include? A nurse is teaching the caregiver of a Parkinson client about levodopa carbidopa. You have to know this medication. I told you, it's a Parkinson. What is the problem with Parkinson patient? Less dopamine. And they have more acetylcholine. That is their problem. More dopamine. We want to give them more dopamine. So that they have less dopamine, we want to give them more dopamine. That's why we give them levodopa carbidopa. So what teaching should you provide? Avoid sudden change. It causes orthostatic hypotension. So that's good. He also don't like protein, but he said no large protein 1 hour before medication. 1 hour is too small, 2 hours. So you should wait for 2 hours. May have to take allopuridol for psychosis. Okay, allopuridol for psychosis. They develop psychosis. If they develop psychosis, look at what I'm going to do. It's because they have too much dopamine. Okay? But the dopamine is helping with their Parkinson. If you give them allopuridol, which is a first generation antipsychotic, it's going to block the dopamine and their Parkinson will worsen. So you should give them second generation antipsychotic. Second generation antipsychotic does not block dopamine that much. So this teaching is not good. We don't give them, that's why we don't give them allopuridol. We give them antipsychotic second generation so that it does not block dopamine. It will turn your urine change color. When you see tics and grimacing, that means you have too much dopamine. You have what? Side effect of the medication. This will not resolve. We need to cut down the dose. So this is also not a good teaching. So the only thing that is good is 1 and 4. So this is just to let you know, dyskinesia is bad when you're on levodopa. If you have psychosis, you should use second generation, and you have to weigh second generation antipsychotic, and then you have to wait for 2 hours if you're on 2 feet or eat large protein diet. That's all. Number 35. A nurse at neurology clinic is reviewing phone call from client. Which client situation need immediate intervention? They are on what? Pregabalin. This is also an anti-seizure medication. It does the same thing as the gabapentin. Weight gain is common. You can feel drowsy, right? It can make your mouth dry. The same thing as the gabapentin. But one biggest side effect of the pregabalin is what? Angioedema. Don't forget it. It's like a Hesi inhibitor. Angioedema, pregabalin. Don't. This is dangerous. Shirt feels tight on the neck. Yeah, your neck is getting swollen. That's why we need to intervene. If you never heard about it before, yeah, that's the biggest side effect. So 4 is your right answer. Number 36. Which client situation need immediate intervention? I'm just giving you the medication and the biggest side effect you should focus on. And nurse at the neurology clinic is reviewing phone call from clients taking carbamazepine. This is another problem too. Carbamazepine. Another problem you should know, right? Which client situation need a problem? Is an anti-seizure medication. Most of the anti-seizure medication are teratogenic. So positive pregnancy, we have to worry about. Carbamazepine is a sulfur drug. A sulfur drug will cause what? Stevie-Johnson syndrome. Small purple rash on your chest is Stevie-Johnson syndrome. Carbamazepine will make you gain weight. This is not a problem. Carbamazepine causes what? Pancytopenia. Some people will say agranulocytosis because pancytopenia will decrease your WBC, your RBC, and your platelet. So that's where the agranulocytosis come in. If you have a fever of 101, yeah, I don't like you. I'm worried about you. Double vision is a normal side effect. That's blurred vision because of the neurological side effect. But teratogenic, Stevie-Johnson, and agranulocytosis are the most dangerous aspect of that medication. Okay? Okay, so that's one of the things you should worry about. 1, 2, 4. Okay. Next question, 37. Which statement from the client need further intervention? A nurse is doing intake history on a client taking what? Sucralfate. no sucralfate and everything about it. All I would say is sucralfate is a cement. So when you take it, it cements your gut. Nothing can get absorbed anymore. And then the rest is story. That's all. That's the content. And then you look at the answer choice. Does it make sense? I told you there's no formula. One of the side effects, because it's cementing things, you're going to get constipated. So I'm on fiber. I'm good. I take the medication twice a day. Yeah, that's the dosage. I take the medication with my other antacid. I told you it has cemented everything. There's no way you can take it together. We can't absorb that. So this one. I'm taking Omeprazole to decrease my acid secretion. I put this there to tell you content. It does not decrease acid secretion. It just coats the surface to make you feel much better and allow the ulcer to heal. People still take PPI. So you wait 2 hours and take your PPI. So that's why this is right. So 3 is the wrong answer. And this is straightforward content. Which drug the nurse should anticipate? You got to make a diagnosis. 5-year-old client was seen in the neuro clinic. What is the buzzword? Blank stare for 3 seconds, multiple times a day. No incontinence or motor control each episode. Loss of motor control. That means you'll be standing there staring for 3 seconds and come back and do his stuff. What is that? This is absence seizure, right? Sometimes they'll call it petite seizure. It's a grand mal seizure, but it's defining case. The treatment, you have to know this drug. That's all. That's what they're going to ask you. If they give you this drug, they're going to ask you for this problem. You know this is an antibiotic. It's not used for seizures. You know this is what? Loop diuretic. Now, you know this is for anemia. Okay. That's your answer there. And Furosemide, you have to know it. Know everything about it, and you'll be golden. 39. Almost done. Select or apply. A nurse is caring for a client post-renal transplant. Which client situation need intervention? They are on what? Cyclosporine. When you see cyclosporine, you call it Sportrain. That's the side effect. I have a YouTube shop and you can watch it. It will tell you all the side effects. At the same time, you know cyclosporine, if I give it to a renal transplant patient, they are immunocompromised. I'm trying to lower the immune system. If you have a fever, I'm worried. They don't need to have fever of 102. 101, 100 is fever for them. Gingival hyperplasia is an expected common sign of symptoms. It's not bad. Your sugar is going to go up. It's not the problem. You have to watch my B sharp. Hyperglycemia is usually not the problem. It's hypoglycemia. That's your problem. Because hypoglycemia can kill you. It ramp up your system rather than hyperglycemia. Kidney function is here. Renal is bad. If your kidney function is high, the medication will go up. Your liver enzymes increases, don't worry about it. Like I told you, the medication has multiple side effects. But there's key ones. When you mix them, patient is going to have morbidity. And that's the one. Fever and kidney dysfunction will make the medication toxic. So 1 and 4 are your right answer. You don't need to pick everything. Just pick though you're confident. 40. And this is caring for 5 clients. Prescribe Rifampin. Zabans, I call them the Zabans. Rivaroxabans. I'm giving you all these medications so that you can go to their class and know everything about them, because those are the one they have to ask you one of this because they are the common medications, Which client statement need further teaching? It's a trap question because they can trap you with this. It's an anticholinergic. It's no coumadin, it's no heparin. I will need frequent blood draw. You don't need any blood draw. I will increase my vitamin K. You don't need to increase it. You don't do anything with this medication. I will use acetaminophen. Yes, because I don't want you to have bleeding. Don't use NSAID. I will decrease my intake of fresh, no diet change. You should use electric blade, electric shaver, so that you don't cut yourself. Further teaching 1, 2, 4, and 5. Okay? Select and apply. Like I told you, I picked these questions, and I know you know, so this is not a lecture. This is just to point to you keywords, but I give you key facts. You have to sit down and go over them, and then write some of the key things you need to know about this medication. A nurse is caring for a client with hypertension, right? Hypertension. I told you what is used for. All of them, most of them, I give you what is used for. That's the way NCLEX will, and then you have to figure out the main thing. There's only a few that will ask you what is used for, but 80, 85%, they will tell you what the medication is used for. That's why I said don't memorize what the medication is used for, and then pick main fact about that medication. But you have to recognize the medication. Prescribe the thiazide. So he has hypertension, we give them this. Then you tell yourself, this is a calcium channel blocker. If this is your vein, okay, it's going to make it bigger and blood stay there. If blood stay there, it's going to leak to the skin, make your skin red. Make your skin red. If you expect edema, don't be worried about it. If your face is red, it's okay. My face is red. If you have edema, you wear compression stocking. You don't have to memorize it. Pathophysiology. It makes you constipated. Drink a lot of water. Yes, this guy, grapefruit juice. Grapefruit juice. Grapefruit juice. I will cut down. I want you to stop it because you make your calcium toxic. Calcium channel blocker, you should not take grapefruit juice. So this is your problem. Cutting down is not enough for me. Stop it. So number 4 is your right answer. You have to do that. 42. Select or apply. Which of the following, so that's the concept for calcium channel blocker. Every calcium channel blocker follow the same thing. It does not have to be thiazide, but that's one I pick. The next you include in the teaching. And then she's teaching you graduate about what? Pitocin, oxytocin, concept. This medication is used to induce labor, right? It can also be used for postpartum hemorrhage. It causes contraction of the uterus. People forget about this. It acts like ADH. So you can retain water retention. So if they give it to you, you can develop SIDH from it. So hyponatremia. You give it by infusion. If you make the uterus contract for a long time, it can go into atonic. It can contract too fast, you develop tachysystole. This is what you check for. You're looking for less than 5 contraction in 10 minutes. I'm giving you a bunch of content. You can, and I don't even believe it. So less than 5 contraction in 10 minutes. And that is OB. And that's what you're looking for. Any contraction greater than 5, is a problem. So tachysystole, we have to worry about it. If the uterus is contracted too much, the placenta can separate. You can develop abruption. All of the side effect is Pitocin. So all of them are right. It's all based on what you need to know about the medication. Select or apply. The client is prescribed what? Risperidone. He has the last name what? Don. When you see Dons, Dons are like antipsychotic. So this is the antipsychotic. It's a second generation antipsychotic. What is it used for? No depression. Mania, yes. You can give it to a patient who has mania to control the psychosis. Psychosis induced with levodopa, yes. It's not used for anxiety. Can be used for schizophrenia and impulse control. Look at what is happening to them. All of them, some agitation thing going on. So you can use the medication for, but it's a second generation antipsychotic. Know everything about this medication. What are the everything? It will cause QT prolongation, gynecomastia. Okay, it can cause weight gain. It can increase your sugar, hyperglycemia. Those are all expected, right? It can cause EPS by lower effect. I mean, the frequency is very low. It can cause NMS. Just know, even though the secondary generation, they can do that. So just, you got to spread your wing. When you see antipsychotic, whether it's first or second generation, they can do the same thing. And then 44. Which teaching is appropriate? Select and apply. And NCLEX is providing teaching to a client 6 months after renal transplant. Now prescribed cyclosporine. I'm back again. I want to hit it, that area. You have transplant. I give you cyclosporine. I give you something to depress your immune system. You should avoid live vaccine. Good. Take the medication for 6 months. Think about it, guys. He has a renal transplant. You want them to take the medication for 6 months? No, life. For life. Need frequent lab draw? Yes. For your kidney function and the level of the cyclosporine. Call with any flu-like symptoms. Thank you. You're going to get sick. Take medication same time of the day. Yes, so that the concentration can be. You see, I'm just using the answer choice and see if it makes sense to the question that we have. Select or apply. That is all it's about. I told you it's immunosuppression, and the rest is story. 1 word or 2 words, and then you look at it based on what you said. Every answer choice, you knock it down by that problem you said. 46, 2 more, then we're done, guys. Select or apply. Which client situation need immediate intervention? And NCLEX is caring for what? 4 clients. What do they have? All asthma. Heart rate of what? 115 after albuterol. Tremor after albuterol. Insomnia after albuterol. Potassium after albuterol. What do you think? Albuterol is a beta agonist. If I give you albuterol, you'll be hyper. Your heart rate goes up. You'll be hyper. You have the tremor. You'll be hyper. You can't sleep. Albuterol pushes potassium inside the cell. It causes hypokalemia. But 3.10 is bad. I'm on these 4. I have to be sharp. My electrolyte is there, and it's too low. I have tachycardia, but that's not sepsis. Tremor is no neurological problem. I'm being sharp. Hypokalemia is cardiotoxic. Choose this one. And the last one for the road. The last one for the road. 27-year-old G1P0 client present to labor and delivery with signs of what? Labor. Which of the following the nurse anticipate? Just break it down. She's not due yet. Now she's in labor. She's contracting. What do you want to do? Do you want to help her contract? or slow it down. You got to bring your content. Say, hey, she's in labor. The examiner is not going to tell you she's in preterm labor. They say she's in labor. You have to interpret it. In labor, 27 week, that's the definition of what? Preterm labor. Then you ask yourself, well, I got to stop contraction. Then you look left. What medication will help me stop contraction? That's all. It causes contraction. Causes contraction. Causes contraction. Slow things down. Terbutaline is like albuterol. We use it in bronchodilation. It's a bronchodilator, but in the uterus, it slows things down. Know that it does not prevent labor. It slows down. It can make you tachycardic like albuterol. It can make you what? Have a tremor like albuterol. It's a beta agonist. You can have insomnia like albuterol, beta agonist. You know, memorize because you know what it does. So when you become tachycardic, the side effect, you can, when your heart rate is too high, you have chest pain. That's when it becomes a B-sharp movement. So somebody on terbutaline with tachycardia is not a problem until they have chest pain. Insomnia until they have chest pain. All of that. So terbutaline is your friend. And this is 41 of them. I know there's a bunch of stuff I said, but I want you to write them down. Go and review everything about them. And then you see that you must have found this is key. It's a classification of, so I pick some class of medication and I give it to you. So take care of yourself and thank you for watching. If you have not subscribed, just check down Adapt NCLEX and visit the channel for more content like that. All the best of luck. Bye.